New COVID booster shots are right around the corner. The FDA just greenlit updated vaccines from Pfizer and Moderna, specifically made to target the XBB 1.5 subvariant. And the shots could make it to your pharmacy as early as the end of the week. So when should you get boosted? And what's the state of the virus here in Massachusetts as we head into the fall? Dr. Cassandra Pierre, the medical director of public health programs at Boston Medical Center, joins me now. Dr. Pierre, thanks so much for joining me today.
Great to be here. Thanks. So
to start off, there's been a recent uptick in COVID cases, across the country. Where do things stand right now with COVID on the rise, and how's Massachusetts faring?
Yeah, we've absolutely seen a late summer rise in COVID infections, and Massachusetts has not been spared from that. We see that this increase continues on. Now, it is nowhere near what we saw during the time of Omicron, the winter before last, nor even this past winter. However, it is earlier than expected or anticipated, and partly related to the circulating variants that we have currently. So yes, it is an increase that we actually expect to continue to see increasing as school is restarting and people are moving indoors again with the start of fall.
So this new shot that was approved by the FDA, it was designed to combat the previously predominant subvariant, if I'm correct. So how effective is it for the new subvariants that have now become the predominant strain?
Yeah, it's a great question. It feels throughout this process as though we're trying to shoot for a moving target as the variants evolve. But the good news is that the pharmaceutical companies, Moderna and Pfizer, have independently evaluated the effect of this recently formulated vaccine against newer circulating variants at this point, and have found that for example, EG.5 or BA.2.86, which are circulating variants that we see at this point, that there is strong immunity produced, or at least a high level of antibodies that are produced after vaccination with the new vaccine. So that is reassuring.
That's great. And so, one thing that I wanted to ask you about is what clearly is vaccine fatigue, in the sense that, only 17% of those eligible for the last booster in the United States actually went ahead and got it. What are you expecting in this rollout for this booster? Are you expecting a lot of people to sign up, and what should we expect from the rollout of this new booster?
Yeah, it is. I have to be honest. I anticipate that we would continue to see some vaccine fatigue, maybe even aversion, or at least apathy. I think that we have seen part of our experience with these vaccines. In part, was formulated by an idea that at some point there would be an end to COVID. And although intellectually we know that COVID is part of our landscape, we may not have internalized that. So I think part of the vaccine fatigue that we see is also wrapped up in a desire to be done and over with COVID, but we can't wish it away. And that COVID, or the vaccine fatigue that we see, also unfortunately permeates to us as clinicians as well. When the other competing medical issues, I find it another issue that I have to address, but it is important for us to do so. And so my answer to your question is I certainly can anticipate that we will continue to see vaccine fatigue, but I think it is imperative for physicians, hospitals, public health institutions to try and as much as possible normalize this experience and compare it to something like the flu, for which we do have precedents of updating our vaccines, and continue to talk about this and talk about the reasons why we recommend vaccination.
And so I wanted to ask you, when the news came out yesterday that the FDA had approved a new booster, it was still unclear what the CDC was going to recommend for who should be prioritized and who should actually get the vaccine and who they were going to recommend it for. Everybody who's over 12 years old is eligible. I believe people between 6 and 11 are eligible under emergency authorization. But from your perspective, who should be going out to get this vaccine? Should it be everybody? Should it be the elderly? Should it be people with autoimmune diseases? Who should go out and get the vaccine when this is out?
Yeah, as you said, we don't have a sense at this point. Hopefully we'll get more information today about who the the recommended populations will be. Certainly, I anticipate that there will be an emphasis on those who are at highest risk for severe complications of COVID-19. So, of course, those who are over the age of 65, those who are immunocompromised, those with multiple medical conditions that predispose them to severe COVID-19 would certainly be on the list because their risk is highest. However, because we have seen a shift in the landscape in terms of the variants that are currently circulating, and these vaccines provide much better targeting, better immunity to these circulating variants. It could be that the recommendation will make these vaccines eligible to anyone. And in that case, I would say that we may want to see this because these vaccines are safe and effective as a correlate to the flu vaccine that we usually get updated every year. So definitely a heavy emphasis on those who are going to have more severe complications. But I also think it's helpful to think about this as a way to reduce infections, reduce getting sick, and enjoy time with our loved ones during the fall and winter holidays too.
So what advice might you have for people who may have gotten the vaccine before, maybe haven't yet even gotten the vaccine, but what advice do you have for people who are feeling a little hesitant about yet another shot this fall? What would you say to people who, are on the fence, if they're not necessarily part of a vulnerable population?
Yeah, that's a great question. I go back to what is the reason for getting vaccinated? Now, for those who don't fall into the risk categories of people who are at higher risk and may have already received their primary vaccine series, it certainly is true those individuals are probably less likely to develop severe disease, less likely to be hospitalized. However, as many of people in that population, that healthy population can attest to, getting COVID-19 infections can be disruptive. They can cause you to feel crummy. And because we've seen this shift in the variants, getting the vaccine can, again, protect your winter holidays, keep your life running smoothly, keep you and your kids on track for that winter vacation that you might plan. So basically, going back to the reasons, the same reasons we might get a flu vaccine, which is to protect ourselves from severe disease, yes, but then also to reduce the risk of infection and allow us to live our lives in the fall and winter and try and take back some of the time that we lost in the past 2 to 3 years as a consequence of this pandemic.
And so given the cases that were, on the rise right now, should Americans be worried? Should people be worried about the direction of COVID now? I mean, obviously, you said this was something that, was expected. It's expected usually around this time of year for a rise in cases. But, given the way things are going, is there anything to worry about? Or do you feel confident that, COVID is still going to be under control come wintertime?
Yeah, I think the good news is that although we're seeing certainly an increase of cases, an increase of COVID-19 concentration in the wastewater, we haven't, in many cases, we've seen a slow rise in hospitalizations, but it certainly is nowhere near the catastrophic increases we saw at the beginning of Omicron or even the Delta variant debuts. We have experienced milder cases, not because COVID itself has become milder, but because we have gained better societal immunity based on our vaccination and our collective history of prior infections. So will this be more manageable? We anticipate that it will be so. However, it is also true that there will be preventable deaths that will occur, preventable hospitalizations that will occur. And so while we expect that this will not be anywhere near the level of disruptive that it has been in the last few years, it will hopefully remain manageable. It is also important as individuals to understand what our risk is and what our goals are this fall and winter and avail ourselves of things that can prevent or treat infection to keep ourselves healthy.
So we just got word in the middle of this taping for viewers, just for clarification, the CDC is now recommending the new COVID booster for all Americans 6 months and older. But Dr. Pierre, I just have one last question for you. As an expert in public health, looking out towards the fall, is there anything outside of COVID that you're looking out for in the coming months as kids are back in school and winter comes up? What are you looking out for?
Well, we certainly had a prolonged RSV, respiratory syncytial virus infection period in the fall and winter, and even part of the summer. last year. And so that is certainly something that we're keeping an eye on. And luckily, we have had some updated or some new vaccines for RSV, which will be helpful for higher risk populations. And of course, flu, as always, it remains on our horizon. And so I think it's helpful to think of COVID as part of this kind of package or trio of major respiratory viruses that we encounter in the fall and the winter. And again, trying to do everything in our power to keep ourselves out of the hospital, surely, but also keep ourselves safe, healthy, and able to enjoy time with loved ones. But yes, there are other viruses outside of COVID that will be part of the landscape this fall and the winter. And, it's always a little bit unpredictable. So we'll have to see what we see for the trajectory for those other viruses as well.
Well, Dr. Cassandra Pierre, I really appreciate you coming on to explain all this to us. Thank you so much for your time.
Thank you. Take care.